All right, welcome back. Without proper planning, healthcare costs can drain your retirement savings. November marks long-term care insurance month. Local financial professional John Vandergriff from Blue Ridge Wealth Planners is here to share how families can plan for higher healthcare costs as they age. So first of all, what is long-term care insurance? Why is it so important, John?
Well, so as we look at it, it's insurance that will help you cover those additional costs, because when we look at long-term care, it's really where you have longevity and health care that kind of meet each other. And so as we look at this, it's important to have, especially if you're in a position where you don't want to sacrifice any of the assets that you have today to cover those costs, or maybe take away from your expenses that you're providing monthly. You want to be able to have some type of solution that you can have that will help cover some of those expenses.
And this is really why you should consider something like this, just because you never know.
Yeah, and sometimes people think, oh, well, Medicare is going to take care of all the health care things. Medicare has some contingencies in there for long-term care facilities. It's not long-term, usually 100 days or less is what you're looking at, depending on what you have, coverage-wise there. Average length of stay, if you do need some type of long-term care, is like 2 years. Oh, so you've got, but there are instances where it can go a lot longer than that. So,
well, so how do we plan? I mean, what do we need to do then?
So as we look at it, we want to make sure that we have an idea of what we need our money to do, and see how much it takes to cover that. And then you see what's left over for what we would call, money that needs to be accessible, and then money that needs to be positioned for long-term growth. And when we look at long-term care, you really have a combination of those two that are working together, because you don't really know when you're going to need it. Hopefully it's 20 years away, but you need to make sure that you have some portion of your money that's accessible and liquid at all times. And typically that money is not going to be as aggressively positioned as kind of long-term growth money. But then, there are a variety of options today. The traditional long-term care insurance, a lot of people have shied away from because it gets more expensive as you age. Some people will go into self-insuring, which is positioning your money the right way. You can even go into life insurance plans that can have what's called an accelerated death benefit, so that even if you don't need it, you're getting something, but you can pull from that. The main thing is just knowing that it's a thing and seeing what you need to do based on your situation to really solve for that.
All right, yeah, kind of analyze, look it over. A lot of options, though. Talk to John, somebody like him. He will guide you through it. As always, my friend, good to see you. Thanks for the advice. Hey.